Medical management of erectile dysfunction. Usually erectile dysfunction develops at the age of 35 plus onwards. Male genital organ gets blood supply by 1 mm diameter artery for sexual function. By the age of 35 usually the geometer gets shrunken. Tablets like Viagra help in increasing the blood supply to the penis, so that the person gets sufficient blood supply into the organ, enabling him to perform the family life. In some people around 35 years, hormonal changes occur among male and female partners. The changes are dramatic in female: excess hair fall, sagging breasts, abdominal protrusion, etc., and distorted menstrual cycles. Whereas in males, they start developing erectile dysfunction, loss of memory, etc. Until 2 decades back there was no scientifically approved medicine like Viagra. Viagra came into the market and there was a big change in the management of erectile dysfunction. The Viagra, medically known as sildenafil, and last for 8 to 12 hours. Tadalafil lost for 36 hours. The latest drug is verdenafil and lost for 8 to 12 hours with very minimal side effects like headache. Usually the side effects are severe headache, severe backache, muscle pains throughout the body, and very few people notice color blindness, a cause of road traffic accidents. All these drugs have to be taken at least 1 hour prior to the expected sexual activity. Absorption of these drugs depend on food intake, etc. In diabetics the disease is in the blood vessels and hence tablets may not work efficiently. The extra time in the sexual activity can be increased by paroxetine. Family life associated with increased heart rate, breathlessness, sweating, tiresomeness. What are all the changes occur during aerobic exercise also occur during sexual activity. If someone has the stamina to run for 30 minutes, he can have at least 10 minutes of family life. Orgasm. A person feels a satisfaction where no more is required. Usually it is observed as relaxed limbs and muscles of the pelvis. Dr. Ramgopal, andrologist and penile implant surgeon.